routine here at More on Mondays, and it's going to be a little bit different today. This is end of session, so everything is a little bit loose. You are welcome to come to the table and sit. I am sure we will not have any other legislators here because both chambers are gaveling in at noon, which is usually they gavel in at 1. And so if you want to come and join us at the table, that would be awesome. I'm Connie Ryan. I'm the Director of Interfaith Alliance of Iowa, and I help to organize Moral Mondays, along with about 25 organizations that co-host Moral Mondays, so we're very glad to have you here and part of the conversation. We're going to be a little bit different today because it is end of session and things happen differently always, and so very delighted to have Representative Lisa Hedens here with us. Liz Mathis, Senator Liz Mathis will be joining us, but she is currently at the Senate and she has to read a resolution, and then she will be here, but then Lisa also needs to leave because she needs to do something with the House and they're caucusing, so we're going to be a little bit flexible today. So we're going to start with Lisa, and then as soon as Senator Mathis comes, we will add her into the conversation. So we're talking about Medicaid and Medicaid privatization and how we find solutions in our state for Iowans. Thank you.
Well, good. I guess it's almost afternoon. Good afternoon, everybody. As Connie said, I am State Representative Lisa Hedens. I represent House District 46, which is Ames. I am the ranking member of the Health and Human Services budget, so I kind of live Medicaid and have been doing that for the last 17 years. I'm also a parent of an adult son with an intellectual disability who's impacted by Medicaid. So I work it and then I live it as well. So just for a little bit of background of kind of who are the recipients of Medicaid. So you have adults, you have children, you have seniors and people with disabilities that if they meet the eligibility criteria may be on Medicaid. About 60% of individuals on Medicaid are children, and they're generally seen as the least expensive population because children are generally healthy. Then we have the adult population, and that is about 21% of adults are on Medicaid. And then the other 19% are people with disabilities and seniors. So that just gives you a little bit of a framework of who's on Medicaid. Now to kind of flip things around a little bit, that 19% of seniors and people with the disabilities that are on Medicaid, they make up about 79% of the expenditures. So when we are talking about cuts in Medicaid, who's the population that's going to be impacted to the greatest extent? What's that? High need, high vulnerable, high acuity population of seniors and people with disabilities. Just want to give you a little framework as to who we are talking about, because oftentimes when I've presented on Medicaid, people just have not had that understanding of who we're actually talking about. So as you know, about 3.5 years ago, Governor Branstad moved to privatize our Medicaid system, and it certainly hasn't been wrought with a smooth transition, but rather it's been quite bumpy along the way. We've had the number of individuals within our state who have seen turnovers in their case management, having to determine which managed care company to go with. As you know, we started out with WellCare, AmeriHealth, and AmeriGroup. WellCare then left, and then we had United, AmeriHealth, and AmeriGroup, and then AmeriHealth left. And now United is leaving the system, and so we will be left with AmeriGroup and the new one that will be starting July 1, Iowa Total Care, which is the daughter or son, whichever you want to call it, of Centene, if that's more of a familiar group that you are aware of. For families, that becomes quite the challenge in determining as to which managed care company do I go with, which one is signed up, which one are most of my doctors signed with, or my hospital, any specialists. It's up to parents again to kind of navigate that system to figure that out. It's presented some challenge with Iowa Total Care not having have all their provider lists out yet. So, and I'm assuming many of you already know that or have seen that in the newspaper. So that presents some challenges for families right now. So what are some things that we can do with managed care? You know, I read the Managed Care Ombudsman's report. If you haven't seen that, it's through the Department on Aging. They do a monthly report and also do quarterly reports. And their top 3 issues since managed care started in the state of Iowa, at least with these 3 privatizations. We have had managed care in the past, but with these current ones in the last 3.5 years, except for the very first month when it started, the top 3 complaints through them have been reduction, denial, and termination of services. Every single month. There hasn't been a month yet that doesn't say reduction, denial, and termination hasn't been a top issue. So I will say when the news came out that a senator from Pennsylvania, over 1,000 miles away, is pushing to see if managed care companies are more for-profit than for services, to me, just looking at those monthly and quarterly reports, I'm thinking, well, absolutely they are, because that seems to be a systemic issue, in my opinion, just here in the state of Iowa. So those are some of the challenges that we see, or some of the things that we kind of recognize that's going on. So what can we kind of do? I've certainly spent a lot of time talking to families, talking to the Iowa Association of Community Providers, that big lobbying organization, to my local providers and to other providers around the state, who all say that in order to help stabilize our Medicaid system is we need to carve out the LTSs population, or the long-term services and supports population, out of Medicaid and put them back in fee-for-service. These are your high-need individuals that need more stability in their system and in their delivery of services. Children, again, are generally healthier. You can use more managed care proposals for them and help their health and well-being, and not that you can't do that for a long-term services population, but that's kind of the nature of it. They have long-term health care needs and very high needs. And so that is a solution that I have proposed, many of my caucus members have signed on to, of saying that's what we need to do. And I will tell you, when I hear from providers, they don't tell me what party affiliation they are. I'm going to assume that they're all cross-party. They have all said you need to carve that population out. I have not run across one provider entity yet who has said, oh no, leave that LTSS population in the managed care system. Every single one has said they need to be carved out. So I'm trying to figure out what's the big deal. Why can't we move that forward when they're all behind it? Certainly it comes down to, this is the place, politics and money. When I looked at that, the managed care organizations got what was it last year, an 8% increase financially. They have in yet this year's financials, they will get a increase or bonus or whatever you want to call it of another 0.5% is in their contracts. When I've talked with Director Foxhoven and Director Randall, each of them have said, well, healthcare is costly, and healthcare costs continue to rise, just like our general insurance continues to rise. But I'm just seeing, in my opinion, the managed care just continue to go up. I thought it was supposed to be, it was sold to us as a cost savings and still maintaining services, and I've just continued to see the costs go up. So the argument of, well, we can't carve out a particular population just does not resonate with me when we're still paying a considerable amount of money for these managed care companies to manage health care, but at the same time, I'm continuing to see reduction, denial, and termination of services. And those are the calls and emails that I get from constituents, and not only just my constituents, but people throughout Iowa that contact me on that. Some of them are saying they're not getting responses from their local legislators, and some of them, their local legislators have referred them to me because it's just not their area of expertise. And so they're not quite sure how to help them navigate, and I'm happy to help them out on that. So a couple of pieces of legislation that we do have out there. One that I proposed was House File 135. That one carved out the long-term services population. It also looked at having the department recalculate the base rates for local providers. You know, the managed care companies want these huge pay increase, but our local providers, their rates have been set at the base level back in 2013. Well, it's 2019, and you know, cost of living comes in there, higher acuity individuals that they're serving, and they're still at a base rate from 2013. So that bill directed the department to also look at, or have the department recalculate those base rates on more current data information. It did not make the first funnel, and it didn't make the second funnel. We certainly tried to amend that language onto the Health and Human Services budget, and it was voted down along party lines, unfortunately. But to me, those just seem like kind of common sense business issues. Carve out a population and help my local business with their rates that are providing services to maybe your kids or grandkids or nieces and nephews, your neighbors, my son, to help them out and to help businesses out. As I said, so that one did not go anywhere at this particular time. It doesn't mean that we're going to stop continuing to work on this. We know that managed care is here to stay, whether we like it or not, and I've heard from a number of people who do not like it at all, particularly ones that have gone through several different case managers. My son was initially signed to WellCare and then to AmeriHealth, so you can see where my track record is in picking out which one he goes with. But we're on our 6th case manager in 3.5 years. So, I mean, that's problematic because each time you get a new case manager, they want to come and meet, you know, your son or daughter, whomever. They want to get to know them a little bit. It's, you know, it's kind of that constant repeating over and over. And I keep thinking, gosh, my last case manager I had for, I think, 12 or 13 years, you know, they knew my son and stuff, and they knew when they went to visit him at work or at home or now in his group home setting, if he was acting a little differently. I mean, they would email me and say, hey, Paul just seemed off today or something. Where now, they're, you know, how can you get to know somebody when you're on your 6th one in 3.5 years? And unfortunately, my story is not something that's out of the norm. That's what I hear kind of across the board from folks is, well, gosh, we're starting a whole nother case manager again. And it is hard on the family member, but it's very hard on the individual who, you know, I sit there a lot of time and talk to my son about safety issues and, you know, who do you go to and, you know, who do you see as that safe person to go to an emergency situation or anything. And now to have kind of this revolving door of case managers really makes him hard for me to explain to him as, okay, this is another safe person to go to. This person's gone. This is another, you know, gosh, I have to wonder what's kind of going on a little bit more in his mind on this. I'm sure he's saying, okay, Mom, these things are not connecting real well, but we're trying to do the best that we can. As I said earlier, it was Governor Branstad who pushed to move to this managed care system. It didn't have legislative input at the time. There are a number of us have been working on this since day one to address the implementation of managed care or not implementing, as it was kind of early on. We preferred that it not even go down that direction. But it is here. So how do we make things better? And I do think that carving out that long-term services population is one thing that we need to do. We do need to help our local providers have their base rates readjusted. You need to have, in my opinion, an independent case management. Many of the managed care companies, their case managers are through their own organization. So it's kind of, what is it, fox watching the hen house. And it makes it hard because the case manager, not only are they there to coordinate the services, but they're supposed to advocate on behalf of that individual and help them get the services that they need. And when you're case management with that particular company, it makes it a little bit hard for them to advocate on behalf of the family or the individual. The other thing that I think that needs to be done, and this was also in my other bill, House File 155, is for to redo what's called the SIS assessments. It's the assessment that is done on individuals to determine what level they are at. So are they a level 1, which means they have the lowest need of support, or are they a level 6 that has the highest need of support? And the old way that assessment was done had a lot more narrative that you could put in, where you could say, well, yes, you know, my son or daughter can do, could ride the bus, but, you know, they might need 6 or 8 months of really intensive support to be able to know how to do this one route and stuff. Now it's just strictly more of a yes or no. And again, those assessments are contracted or done by the managed care companies. So they're doing the case management and they're doing the assessments to determine where you're at. That just does not sound right. That should all be independent in doing that to determine, okay, where is that individual at? Who's going to help coordinate and advocate on behalf of that individual? And then have the managed care company be the ones that are the payer of that particular service. And our system is, it's all locked into one entity. And so I think it makes it very hard for families to work in that, or the individual to work in that, because you're up against the managed care company, the case manager, and the assessment that don't seem to be maybe as all encompassing and a little bit more biased based on who they are connected with. So those are just some initial problems that we see with the system. I'm always happy to take input from anyone if they've got particular solutions other than what I've come up with. Again, and it hasn't just been myself alone. I've certainly reached out to a number of entities to say, please help me. We know we need to fix the system. We know it's not probably going to go away. What can we do? I may have some expertise in Medicaid, but I'm certainly not the expert in Medicaid. And so that's where I find it important to hear from providers, from individuals, giving me that input so that we can kind of determine what is a direction to go and have that dialogue. And then try to work with my colleagues on the other side of the aisle and present them with a plan and the data to say why it's important to make some of these particular changes. So those are some of the struggles that we are up against right now. I'd love to say we're going to get that carved out before the session ends at maybe the end of this week or next week, not quite sure around here exactly when our final day will be. But I know that I won't be giving up on continuing to try solutions because, as I said, my own family is impacted by it, and a number of my friends are impacted by this, and so we need to figure something out that everyone can come together and make some adjustments. I am happy to take a few questions if folks have.
Caucus is not starting until 12:30. So
Oh, okay, I got a little bit more time.
Yeah.
Okay, wonderful.
So if you have questions, Lisa will take some of them. Go ahead.
I'm just curious. Most of us are thinking that these two connecting MCOs, and particularly with Total Care being brand new and not even having their network set up, how realistic is it that they can actually absorb over 400,000 people if they each take half even? That just seems insurmountable. So number one, what are you hearing, if anything, about that? And if it is something that they can't do, you remember last time when AmeriHealth left, the state did take some. It would seem to me, if I'm in CO, and this is going to really throw my whole thing off, that maybe I would entertain the idea of carving out this most difficult population. But what are you hearing?
Yeah, good question. Yeah, I have heard some, and it is kind of interesting, especially since not only have you had one, but now two managed care organizations that have left. And many of them say it's because we're losing so much money within the system. And
And those two organizations had the bulk of the LTSs funding.
they did, right. So AmeriHealth said that they had a lot of experience with that high need population, and so they did take the bulk of that initially. They were saying they were seeing significant losses. They couldn't maintain all of that, so that was one of the reasons they left the state. So then United Healthcare absorbed many of them, or I actually think about all of them, because AmeriGroup at the time said, no, we're not up to full capacity yet to be able to take that on. We're new into the system. We can't take anymore. They kind of recognized that they need to just stabilize with the populations that they've had. So there is some concern of, okay, now we have United Healthcare leaving. Can Iowa Total Care absorb them all? Or, you know, if you just think about it, we were going to have 3 managed care companies. So they're each going to get a third. Now they're each going to get half. So it's having just that general capacity of not only can you service those individuals, but do you have enough case managers or, you know, other staffing just to be able to meet the needs of it. I have talked with actually both. I talked with the Iowa Total Care local director here. I've also talked with Director Foxhoven, and both are saying, yes, we can absorb it. We'll be up and ready to go. You know, I think time will tell if that is accurate. I'm a little cautious on that because I heard that before. And obviously they weren't ready for that or didn't have the ability to maintain that particular population or that volume of individuals. So I cannot give you a definitive answer, but I do know that I have concerns on that.
You had a question, Nick?
Hi there. Thank you for coming. My name is Evan Schultz. I vote in Fulton County. I watched a clip. I think it was Representative Miller's meet. Said something about for the LTSs to carve out the infrastructure to make that happen doesn't exist yet. And I would like to request, like, can we work on that sort of thing? So I think that would be great. I had a spinal cord injury in 2016. I ended up landing with the mayor group not because I made a wise choice. I just got lucky. So I'm here on behalf of a lot of my peers and anyone that's going through the having to bounce around. I think the ripple effect of even thinking of the case managers, having to go through a lot of them is a definite struggle, but I also think of the actual staff that have to worry that the company that they work for might not be around. Does it affect maybe their determination to totally put all their effort into their job, possibly worrying that something that's happened to a prior company might happen to them? I think there's a lot more ripple than we even imagined to this.
You know, and I agree on that. We don't have the best infrastructure right now over at the department because a number of those case managers and staff left and are working with some of the managed care companies now. But if we would end the contracts or carve out that population, the money that you're not putting towards the managed care companies to maintain those individuals, you could certainly put back into the department. So certainly if you say, okay, we're going to carve out this population, you're going to set a deadline as to when you're going to have that done so that you're going to have some overlay of transferring from one area to another. So you're right, and you're absolutely right on. There is issues with the local providers. You know, if they aren't getting funded enough, they cannot maintain their level of individuals that are providing the service.
Yeah, I guess my question also would be, I get services just to get up and get into bed. And if I didn't have them, I wouldn't be here. So what do you think about reimbursement rates for home health care providing agencies and the like?
Well,
How do we make sure that they get paid?
Yeah, I mean, that's something where we need to increase the rates on that. That again is another area where it has been a struggle. And that's where, you try to portray it, and in my opinion, it's an economic development. Those individuals are working in their communities at those small businesses and providing a very high needed service. But we tend to look at economic development as the Apples and the Google corporations, not as those more small town or even urban area, but smaller home visits that provide a service to a very vulnerable population. And that needs to change.
Before you do your question, I want to introduce Senator Liz Mathis, who has joined us, and give her the opportunity to, I know you haven't been part of the conversation, so it's a little bit weird, but if you want to say anything, Lisa's done a great job of kind of doing an overview.
Thank you.
And then we'll get back to questions if you have anything that you want to just share.
My apologies, we had, from my area, we had a college men's basketball team come in and we wanted to honor them, so they drove all the way to Des Moines for that. So my apologies for being a little late. To just update you, Senator Bob Casey, who's on the Special Committee on Aging and on Medicaid, Medicare services, was asking for the Office of Inspector General to investigate managed care organizations, and so Senator Amanda Reagan and I definitely joined in that and wrote a letter encouraging them to include Iowa, and he did. So they will be investigating, the office will be investigating managed care from the basis of pre-auth and a couple of other things, not all of it, because it would just be so broad, a broad investigation, but they do want to find out why there are delayed payments and the hesitation to, approve pre-authorization for several things. And so they mean business, and it could take about a year for them to uncover or to discover or investigate to the point of taking managed care organizations to court over this, but we just have to keep pushing forward because it's so unfair, so unfair.
Not so much a question, but a comment about my activity with this. I belong to a group called Iowa Parents for People. We have a number of members, mostly in Central Iowa. And that seems to be a little bit of our problem, is that we're mostly in Central Iowa. Recently we spoke with Senator Costello, who told us that he was just not getting the calls that he used to get. And I think people are probably getting beat down and just tired of not getting any response.
Or getting any resolution.
Exactly.
It depends on who you call and who pushes hard enough.
Mm-hmm.
So I decided to reach out to family members and friends who live around different parts of the state. I have a brother-in-law in southern Iowa who said at a funeral 2 weeks ago with Cecil Dolchek, a representative. He also knows Mark Costello. He has family in northwest Iowa, all Republican strongholds. And I've talked to people actually 5 different people who I explained the situation. They know my son. You may remember a letter a couple of weeks ago about a 40-year-old man named Ben with autism. That's my son, and that is my concern, is for my son. But it just seemed to me that it might help if we got more people bugging these people and telling them that there's a problem. And the people I contact, I don't tell them that you have to be an expert. I tell them that what you know Ben, okay? So you know some of the things that he needs and some of the things that are going on, but you don't know much about managed care. What you need to do is just contact your legislator and tell them that you have a family member who's involved in the care system and they're having problems. And the problems that we are dealing with are really tough on someone with autism. I mean, they're tough on everybody. But we lost a case manager that we'd had for over 10 years. We were fortunate enough to get a good case manager with United Healthcare. Many people did not. So now we're going to lose this case manager and have to go with our third managed care company. But I just thought that reaching out to people in different parts of the state would help and keep the letters coming.
Yeah, I mean, I think wherever we hear from, I mean, I certainly get every day someone's contacting me, whether it's a provider or family. And they're not all from my area. They're from all over the state. And so, yeah, I have to wonder, is there a legislator not listening? Is it someone who is referred to me? I don't know, quite honestly. But I do know that some of my colleagues say, well, I just don't hear from my providers anymore. I don't hear from families anymore. And I just think some of them are kind of beaten down. It's like, okay, we're not getting any resolution. And, my kind of motto is, if you don't say anything, then we tend to think things are okay. You have to tell us that there are problems out there for folks to listen, and you need to keep it in the forefront all the time. And I know it's hard and I know it's exhausting, but if we don't continue to hear that, my colleagues are thinking it's A-okay.
And that's what several of the Republicans told us. We are just not getting the calls that we used to. And I don't know. It should not be a partisan issue. Healthcare
I would
should not
agree.
be a partisan
I would agree.
Just on my way here, so I drive from Cedar Rapids, it's about 2 hours, and I returned 3 calls. One was from a woman from Dubuque who had already called Senator Yoakum, but she wanted me to know what she was what she had encountered, and if there was any way that AmeriGroup could change something in regard to a CDAC provider and payment, whether it was a check or through a debit card or or through your bank statement. Then there was a gentleman who was calling from Northwest Iowa. He had already contacted his senators and got absolutely no response back. And so his alternative was to call me, and he had just looked through his total care contract, and on the very last page of the 40-page contract was where the reimbursements were going to be made, and it showed ancillary services at a 40% reduction. And so he said, what's our alternative? Now United Healthcare's gone. It's between AmeriGroup and Total Care, and this is what they're saying for ancillary services like oxygen in your home, or being able to do some type of dialysis in your home. And it was a 40% reduction. He said there's no way that we can offer these services at this low rate. And then he had some other issues, and so we were going to do a conference call between Jackie Smith, who lives the closest to him. She's still out of his district, but lives the closest to him, and then our Senate analyst, and then a couple of other people to see if they could solve this issue, or how he begins negotiations with them, and how he can enter into this. The third call was from a gentleman who owns a nursing home in Cedar Rapids, and he has a large number of Medicaid, Medicare patients, and he's very concerned again about rebasing that's in the HHS budget, and how that then is juxtaposed to what their reimbursement rate is and what will continue to be with this new contract. I also had a call from someone who looked on the network providers for Iowa Total Care, and 3 weeks ago only found 3, and it was 2 chiropractors and a primary care physician, when it should be thousands on there, 3 providers. So that's a problem. In the Senate, we've met with the very first week that United Healthcare decided that they were going to end negotiations and withdraw. We asked for a conversation with Mike Randall, and with Jerry Foxhoven, and they sat down with us, and we had a lot of questions. We asked them to keep us updated weekly on the transition to Total Care, because that's where I'm getting a lot of my calls. People are, what do I do? Do I go to AmeriGroup? Do I, and I can't tell them which managed care, which insurance company to sign up for. I just say, why don't you look on their provider network, see if your doctor is on there. If they aren't, wait maybe another week and see. You have this much time, so I'm giving them the dates and things like that. But if they need care now, to get it now, because United Healthcare is going to diminish. They're going to not approve any authorization, because they're pulling out of the state. So, I'm just telling them, if you need treatment, get it now, because you won't probably won't be approved in June. I'm just assuming that. So we're getting a lot of calls about, people are a little nervous about this transition and choice, really. We expected that there would be 3 or 4 managed care organizations, and now there are just 2. And so when we were asking Foxhoven and Randall, to explain that, along with many other questions we had, we've gotten partial answers for things. They say they're keeping us updated. They met with us last week on HIP.
And I met with both of them prior as well.
On HIP, and I'm a little nervous about that because Mike Randall wants to just let that go in rules and change it in
The health
rules.
insurance premium payment program, and so it has folks that are still in the fee-for-service area, but their main insurance is under maybe their parents.
Private insurance.
Under their private insurance is their payer of first resort.
So the state pays their premium in order for, and they have access to private insurance, but then they pay the out-of-pocket costs for, whatever might occur. It really saves the state money, but they may get, the whole family can be on private insurance at a reduced cost. So the state's willing to partner. They want to change that. That's a proposed rule. There was a window of opportunity for HIP recipients to talk about how they may have benefited from it, or encouragement or discouragement, and that window was only 3 weeks long. And so everybody I knew that was on HIP in Cedar Rapids, I asked them to write a letter and who to write it to, and we're continuing those discussions. We're trying to convince those who are writing the proposed rules to make sure that they hear from all these people and take into consideration their situations. They can't really tell us what the cost savings might be. That's the troubling part. Are you sure? Are you sure of that? No, we're not sure, but we feel that it's the right thing to do. I think the next thing that we need to watch out for is dental. And that will be a decision that Mike Randall will make, just to remove dental from Medicaid. And then the next thing nationally, if you have this many states doing managed care for Medicaid, Medicare is next. And so if Medicare goes to managed care, then we have some really big problems. So, it's just this chipping away, right? Chipping away with groups that don't understand that government can do good. It can work out. So we've really focused on trying to not so much keep pleading with the governor to take it all back for fee-for-service. We have been working with her office in looking at things that can change in managed care, things that need to be changed, like pre-auth pieces, standardized forms, what the true definition of what is medical necessity, and that it's the same for everybody. Independent case management, and they tell us no one has that across the United States. Well, why not? It's needed. CMS indicates that they should have independent case management. Also, a third-party appellate. So, like if the provider and the managed care organization kind of come to blows over a payment or a clean claim or whatever it might be, and the managed care organization says, well, this is the way it is, and go away, that there could be a third party that would come in and mediate instead of taking it to district court to try to get a new wheelchair or bowel care. You shouldn't have to go to district court to fight to get your services. So I think a third party would be a good situation for everybody because it's a low-cost option, and we could certainly do it. The Ombudsman's office needs help, so we wrote an omnibus bill that had a number of these things in it, including, beefing up the Ombudsman's office, because I am still getting a volume of calls. Every week calls, text messages. I get direct message through my Facebook account. Okay, wait a minute. We got to go through email here so that I can do this professionally and as part of my office. So I get a lot of those, though, because people are reaching out to you. They don't know how else to get a hold of you. So, but I have about 250 cases on a spreadsheet of everyone that I've kept track of that we've helped come to a resolution, and if I don't know the resolution, I call them back and ask them, were you satisfied with what happened? If they aren't, then we keep pursuing it. So my clerk is really tired, and so is Chris Bell, our Senate staff, but not as tired as the people on the other end who have been on the phone for hours trying to get services. So, yeah, it's still a problem. Still a problem. Yep.
Rick, you had a question?
I do. First of all, thank you so much for what you're doing with the most vulnerable Iowans. My question is about Centene. They paid over $24 million in fines and penalties in 12 other states.
Mm-hmm.
They were rejected in 2015 because they failed the DHS evaluation. And I'm wondering now, is this the last resort? Are we down to the last MCO because there are no others, and we're picking someone that was rejected before and has been fined over and over again for the very same things that we've been experiencing here?
Yeah, now I know that there's a few other managed care companies out there, whether they would want to come into Iowa or would have the capacity in Iowa. When I first chose AmeriHealth, when we initially had the three, I mean, I picked them because they had the least amount of lawsuits against them. And I thought, that's really kind of bad as a parent of how you're choosing your health insurance is, which one that has the least amount. And, now they've left. So, yeah, I mean, it's a real issue when that's what families do to make their determinations. I think it's something that we will certainly be watchful about. And I think that's where, as the senator said about Senator Casey, yes.
Bob Casey.
Yeah, I want to say Corey, and I knew that wasn't right. That he's saying we need to take a look at this. It's not as expansive as I'd like, but at least they're chipping away at one, a small segment.
And Warren and Gillibrand are also on that committee, and
Yeah.
I've reached out to them, and Elizabeth Warren called me back and left a message, and Kirsten Gillibrand's staff called back and said, tell us more, we want to know more. I mean, they know what's going on, but how can they help?
Right.
They're on the ground here in Iowa, they can see what's going on, they hear the conversation, so it's very valuable. If you go to any one of their rallies or something, let them know that you're there and let them know that this is meaningful to us.
You had a question?
I'm wondering, I participated in some webinars and some recent things within the past 3 months where national advocates are saying that in terms of the long-term services and supports population, and even within that group, people with intellectual and developmental disabilities, the vast majority of states that are doing Medicaid managed care do not include that population.
Right.
And so I would be curious to ask, if y'all get the chance, because we won't, to ask the MCO directors here, how many other states do they work in where they actually provide long-term services and supports to people with intellectual disabilities, with developmental disabilities, because they want to talk about their experience with long-term services and supports, and they really don't have it.
Right.
Some states that are doing Medicaid managed care that include that population, they're only doing the medical care. They're not doing the long-term services and supports. And I think it would be interesting to know from these CEOs, how many other states do you work in that you do Medicaid managed care where you are actually doing the long-term services and supports? And if you're doing it, what populations are you doing that for? Because they do not have experience.
When we were on a conference call with CMS back in 2015, it was September of 2015, so the bids had been let. We knew who the managed care organizations were going to be, and so we had called
several times we did.
Kansas legislators. We had called other states that had managed care and asked them, what do we
Minnesota.
do? What do we write into these bills that are going to come up, in January? How do we adapt to make sure that we have a cushion here for the blow? And so when we called CMS, I asked Jim Golden with CMS, who's still there, how many other states have pushed everything across the table? All the waiver programs, all 7 waivers, everybody, including the well population, everybody. We were the only state. And we were the only state, he called it ambitious, I think he was being nice, but that we would try to build a system in 4 months, so September to December, and then remember that January 1st was the deadline that Branstad put on it, and then moved it to March and then to April. But we called for field people to come out from CMS. We flew to Washington, D.C. in November of that year, Pam Yoakum, Amanda Reagan, and I, and just pleaded with them. We sat around a table in the West Wing. It was surreal. And we had a big notebook full of petitions and just said, look, this is not going to work for us. And their answer to us was, Iowa presented a plan to us. We react by saying, we'll be your partner if you do these 19 metrics. And that's all we can do. Your governor has decided that this is what he wants to do for the state of Iowa, and he presented a plan to us, and this is how we react. Well, we said, can you come and hear what's going on? Just hear what a mess this is. So they did. They sent field operations here in early December, and then about mid-December said, okay, you're not ready for prime time. But it was only delayed till April, and so there was a lot of wheel spinning in January and February. But, you know, we've looked back a lot. We've looked back. We can't correct it, right? You can't course correct it. Some of the states that have been more successful have waived in their LTSS community. So that for 10 months, you know, they'll bring in a population and see how that works, and then the next. So it's been like maybe 3 to 5 years of, you know, transition. Governor Branstad didn't want to do that. He just wanted it, you know, and I think it was lack of information, really a lack of understanding about how effective or not it was going to be. And I think he got some bad advice from his staff and maybe from his council. But I think they realize that now, and Governor Reynolds wants to fix what's in front of her. But she's not willing to go back to fee-for-service. She's not willing to go back to that infrastructure. And I've asked her, if you carve out LTSS and we rebuild an infrastructure for that community, you're talking about 70 to 80,000 people, maybe 70,000 to 80,000 people across the state. And the rest would be people who are not LTSS or not part of the waiver, you know, or a chronic illness. And so that's not a lot of infrastructure to build, but it's intense. And I think we could do that, and then we could manage the other population fairly well, because I very rarely get any complaints from anyone who's outside of LTSS.
What does she say?
She says we need to give it time. She's told me several times, we need to give it time. We need to give it time.
I know that Representative Hedden, has to go, and has to go caucus, and I want to thank both Representative Hedden and Senator Mathis, please. This is our last Moral Mondays of the year. We are talking about having a wrap-up kind of conversation on bulk of issues after we rest from the end of the session. So stay tuned to that and see if we can put that together with some of our colleagues in the different organizations. But it's been a good year of conversations and information, and for those of you who are here on a regular basis, hopefully you got a lot of good information throughout the session. For those of you who are new and just here today, glad you are here. We do Moral Mondays each Monday for most of the session, and so we will be back in January. So, thank you. Thank you.